advances, I feel. But still, what is the goal of therapy? We can improve obesity related comorbid conditions. We can reduce the risk of developing future comorbidities. Treatment plan depend upon the risk status, expectation, and available resources. Therapy begins with the lifestyle management. It may include pharmacotherapy, surgery, and depending upon the BMI and the risk factors. That you have seen the way Adnan Sani has reduced fat to fit, and Ambani's son, he has reduced in between, then again he has gained. Must be some genetic related to Ambani's son, Anant Ambani. Now, what are the drugs? The drugs we use regularly, but only sometimes we are using like early stage. It has a mechanism of action on gastric and pancreatic lipase inhibitor. It is 121 milligram 3 times a day with fat containing meal, but it has a side effect like cramps, flatulence, fecal incontinence, oil spotting, and the fat soluble vitamin deficiency. But this drug is approved. I think most of the people must be writing only early state, and this is approved. Others, I am just telling you the names. Sibutramine, that is withdrawn because of the side effect. It has increased risk of MI and stroke. And the lorcaserin, that is a serotonic 2C agonist. It is 10 milligram twice a day. But the side effects are headache, nausea, dry mouth, and the constipation. One more drug is there, that is a phentermine topiramate, and that is also approved. But normally, as a gynecologist, as a journal, we people are not writing much. But it has effect on non-adrenaline releases, and it has an anticonvulsant also. And what is next? After the pharmacotherapy, then there is a bariatric surgery. It is by far the most effective long-term treatment for obesity, and it is associated with reduced mortality, mostly done in severe obesity, BMI more than 30 or more than 40. And it has a significant complication. The patient has significant complications such as type 2 diabetes, hyperlipidemia, or obstructive sleep apnea. What all are the procedure? You must have seen. One is very important, laparoscopic adjustable gastric binding. You just, there is, if do some only binding, that will have a very good result. Then the sleeve gastrectomy, the part of the stomach, it's removed. Then the rocks and Y gastric bypass. When they bypass the stomach, that is the rocks and Y gastric bypass. One more is has come in the market, that is biliopancreatic diversion with the duodenal switch. And one more is their pancreatic diversion. I'm just giving you the names, what all type of the bariatric surgeries are there and their side effects. Like if we are doing the gastric banding, then 50 to 60% expected weight loss will be there. Adverse effect will be there is a band spillage, then the erosion, stricture, port site infection. Mortality is very less, 0.2% in experience center. Then the sleeve gastrectomy, 50 to 60% expected weight loss. And in this case is iron deficiency, vitamin B12, and the mortality again is 0.2% in experience center. Then Rose and Y gastric bypass, nearly expected weight loss is 70 to 80%. Only adverse effect like internal hernia, Grumping syndrome, hypoglycemia, iron deficiency, vitamin B12, vitamin D deficiency, but mortality here is 0.5%. One is duodenal switch, that is expected weight loss is nearly 100%. But there is a more and more adverse effect like steatoria, protein caloric malnutrition, iron deficiency, vitamin B12 deficiency, then calcium, zinc, copper deficiency. Here mortality comes nearly 1%. Now, my talk is just to tell what all the drugs are there, what all are the surgery. Now, I'm going to put everything all together. It's like a conclusion. Obesity is a disease because it causes problem with your physical, mental, and metabolic health. If you are unable to lose weight on your own, get help from your doctor. Chances are right, it is not just the weight. Chances are you do have complication of obesity. Everyone who is obese deserve a thorough medical checkup at least yearly. Clearly, the risk of many medical complications is increased with obesity. Even Hippocrates wrote so many years ago, corpulence is not only a disease itself, but the harbinger of others. Now, this is the very latest, just I took it from Times of India. And this one slide from Dr. Sharda Jain ma'am yesterday, she shared Golu, Motu, Teddy, Laddu, Hathi, Bhalu, Gappa. They laughed, they judged, they dismissed, they called it baby fat, heavy bones. They said, just eat less, move more. But words have weight, weight of stigma, the weight of blame, the weight of being told it is all your fault, of being reduced to a nickname instead of being seen for who you are and your potential. People keep on telling कि ये मोटा हो गया वैसा हो गया उसका nickname आ गया, but they are not able to see what is the solution, what we have to do. Thank you. Thanks a lot.